Helping youth quit substance use is a journey that demands understanding, patience, and proactive involvement from parents. Around the world, adolescent substance use remains a pressing issue, touching families from every background and continent. According to the Centers for Disease Control and Prevention, about 15% of high school students in the United States have tried illicit or injection drugs, and 14% have misused prescription opioids. These numbers are mirrored in many other countries, where alcohol, tobacco, and other substances are readily available to young people. But no matter where you live, or what your family's cultural background may be, there are universal steps parents can take to help their children break free from substance use and build a healthier, substance-free future. The first and perhaps most important step is to establish clear rules and expectations regarding substance use. Parents should have honest, ongoing conversations with their children about the dangers of alcohol, tobacco, marijuana, prescription drugs, and other illicit substances. Make it clear that you expect your child not to use these substances, and explain why these rules are in place, not just as a form of discipline, but as an act of love and protection. Research from around the world has consistently shown that young people who understand their parents' expectations are less likely to use substances, regardless of their cultural background. Next, it's essential to monitor your child's activities and peer associations. Adolescents are strongly influenced by their friends and social circles. Knowing who your child spends time with, where they are after school, and what they do in their free time can help you identify early warning signs of substance use. Encourage your child to bring their friends home and get to know their families as well. By keeping communication open and non-judgmental, you can foster an atmosphere of trust where your child feels comfortable discussing their social life with you. Open communication is a cornerstone of prevention and recovery. Create an environment where your child feels safe to share their thoughts and feelings without fear of punishment or shame. Ask open-ended questions and listen carefully to their answers. For example, instead of asking, "Are you using drugs?" consider asking, "How do you feel about the things you see your friends doing?" Or, "What pressures do you feel at school or in your community?" This approach encourages your child to express themselves, making it easier for you to understand their experiences and provide the right support. Providing emotional support and positive reinforcement is equally important. Adolescents who feel valued and supported by their parents are more likely to make healthy choices. Praise your child for their efforts to stay substance-free and celebrate their successes, no matter how small. If your child has already begun using substances, reassure them that you are there to help them, not to judge or punish them. Let them know that everyone makes mistakes, but quitting is possible, and you'll support them every step of the way. Let's look at some specific strategies for different substances. Alcohol remains one of the most commonly abused substances among youth worldwide. To help your child quit alcohol, talk openly about its risks, including its impact on brain development, academic performance, and long-term health. Set firm, consistent rules about alcohol use and be a positive role model. Demonstrate healthy coping mechanisms and responsible behavior in your own life. If you live in a culture where alcohol is part of social or religious rituals, explain the differences between moderate, responsible use and abuse, and help your child navigate these situations safely. Tobacco use, including cigarettes, e-cigarettes, and hookah, is another widespread issue. Global health organizations estimate that over 80% of the world's tobacco users started before the age of 18. Quitting tobacco requires a combination of education and support. Discuss the immediate and long-term health risks, such as lung disease and reduced athletic performance. Help your child identify triggers that lead them to smoke, and work together to develop healthier alternatives, such as exercise, hobbies, or spending time with friends who do not use tobacco. Celebrate each day your child remains tobacco-free, and consider seeking medical advice for nicotine replacement therapies if necessary. Prescription drug misuse is on the rise in many countries, with opioids, stimulants, and sedatives being commonly abused. Parents should securely store all medications, dispose of unused prescriptions, and educate their children about the dangers of taking drugs that are not prescribed to them. If you suspect your child is misusing prescription drugs, approach the conversation with empathy and concern, not anger. Work with healthcare professionals to develop a safe plan for quitting and managing withdrawal symptoms. Illicit drugs such as marijuana, cocaine, and methamphetamine pose serious risks to adolescent health and development. The global statistics are alarming, with millions of youth experimenting with these substances each year. If you discover your child is using illicit drugs, remain calm. Express your concern and love, and avoid blaming or shaming them. Seek professional counseling or treatment programs that are culturally sensitive and tailored to your child's individual needs. Many communities offer support groups for parents and youth, providing a network of encouragement and shared experience. Across all these substances, seeking professional help when necessary is vital. Addiction is a complex condition that often requires intervention from trained professionals, including doctors, counselors, or therapists specializing in adolescent substance use. Don't hesitate to reach out for help. Early intervention can make a significant difference in your child's recovery. Globally, studies have shown that parent-based interventions can reduce alcohol and tobacco use by more than 12% and illicit drug use by nearly 14% among adolescents. Increased parental monitoring alone is linked to a 1.6-fold reduction in substance use initiation among young children. These numbers highlight the power of parental involvement and the difference it can make in the lives of young people everywhere. No matter your family's background, your involvement, understanding, and support are the most powerful tools in helping your child quit substance use. By setting clear expectations, monitoring activities, fostering open communication, and seeking professional guidance when needed, you are laying the foundation for your child's healthier, brighter future. For more advice, resources, and stories from families around the world, subscribe to the Retrack Renova Initiative's YouTube channel. Join a global community of parents and caregivers committed to supporting youth in overcoming substance use and achieving their fullest potential. Together, we can make a difference, one family, one child, and one step at a time.